Good morning, everyone, and thank you for joining us today. Or actually, good afternoon, everyone, and thank you for joining us today. My name is Sushi, and I work as one of the graduate academic assistants here at SARAVYC. We're very excited to continue our Lunch with SARAVYC series with a session that touches on an important and timely topic. With that, it's my pleasure to introduce our next speaker, Dr. Adi Ferrara, a postdoctoral researcher here at SARAVYC. She earned her PhD in health sciences from the University of Canterbury in New Zealand, and before that worked in Washington State as a medical writer and project manager at the HIV Vaccines Trials Network and Seattle Genetics. At CERAVIC, Addie works on several qualitative projects, including the online youth focus group she'll be sharing about today. She'll be talking about how cultural differences shape parent-teen interactions during the coming out process. Just a quick reminder to keep yourselves muted during the sessions, but please feel free to drop in questions during the chat. And with that, Adi, I hand it over to you.
Thank you, Sushi, and thank you all for being here today. I'd like to start by acknowledging my colleagues on this project, my research assistants, Jimmy Chokmisuk and Shannon Shrivastava, Dr. Monica Rana, SARAVYC's managing director, who is a co-investigator on this study, and Dr. Elizabeth Saywick, SARAVYC's director and principal investigator. We'd all like to acknowledge and thank the study participants for their thoughtful honesty in the course of this study. And the study was funded by a grant from the Canadian Institute of Health Research. So why do this study to begin with? Family connectedness is an important factor that affects sexually minoritized or LGBTQ youth's health and well-being. The relationships with parents, between parents and adolescents, is predictive of successful identity development and future psychosocial adjustments as teens move into adulthood and go on to independent lives. Yet the coming out process is fraught. Adolescence is a time of general identity development, not just sexuality and gender. So the potential for conflicts with parents already exists as adolescents move from being the parent's child to their own independent person. Therefore, responses to an adolescent's coming out as LGBTQ are varied. They range from complete acceptance and unconditional love to outright abuse and violence, and that includes all verbal, emotional, and physical, as well as loss of housing and financial support. It's worth noting that up to 40% of Canadian homeless youth identify as 2S LGBTQ+. Cultural norms and traditional beliefs have an important effect on the parental responses to coming out. Today's discussion concerns a sub-analysis of a bigger study. The main study explored the coming out experiences of Canadian 2S LGBTQ+ youth in relation to the parents or caregiver responses. This study I'm discussing today centered on the differences in responses among specific cultural groups. So the main study recruited Canadian youth aged 15 to 22, so teens and young adults, identifying as sexually minoritized. That would be gay, lesbian, bisexual, or anyone who considers themselves sexually queer, so LGBTQ. We analyzed 156 we had 156 participants that went into the final analysis. We actually had 161 people recruited, but we could not verify the identity of 5 participants, and so they were not included in the final analysis. We had 12 online asynchronous focus groups. The focus groups were run on a platform called PHPBB, sorry, which is a bulletin board system. The groups, each focus group ran for 3 days each between September 2020 and August 2021. The participants had to answer the questions first on the bulletin board before they were able to see the other participants' answers. And we did that because we didn't want anyone to be influenced by majority opinions or any such considerations. So the opinions were their own first, and then they were able to respond to other people. So out of 12 groups that were in the main study, 2 were gender diverse group and 10 were gender binary, men, women. So participants who also identified as gender diverse had a choice between the 2 gender diverse groups, or they could join one of the binary gender groups listed above. The data from the gender diverse groups are not included in this study. We are only looking at the 10 gender binary groups in this study. The groups, all 12, were further separated by population type. So we had, I'm sorry, all 10. So we had a general Canadian group. Those are non-immigrant families that came from urban and suburban environments in Canada. We had a South Asian group where parents were first-generation immigrants. We had East Asia group where parents were first-generation immigrants. And we had participants, non-immigrant participants from rural Canada. The participants themselves, the youth that were South or East Asian, were either born in Canada or came here at a very young age, and so they practically grew up here. While participants were asked about their experiences coming out and what they considered supportive or non-supportive behaviors in the context of coming out, they were also asked for recommendations on how parents can increase their support. Across all groups, regardless of background, the number one recommendation from participants was for parents to be better educated on LGBTQ plus topics, 2S LGBTQ plus topics. And this is important because, as I said before, cultural traditions and beliefs impact how parents react to a person's coming out. And participants felt that the more the parents knew, the less negative their responses would be if they were educated beforehand. The East and South Asian participants reported that parents treated the LGBTQ plus identity topic as taboo, for example. So they would not talk about it. If the children brought it up, if the teens brought it up, they would ignore the topic, change it to something else, and nothing would ever be discussed again in that realm. Other participants from the East and South Asian groups reported that their parents held on to the traditional belief that these cultures have, that being LGBTQ plus is a white person's problem. Participants said, for example, one participant said, "My parents told me you can't be Chinese and be gay at the same time." So there is a very firmly held belief that LGBTQ doesn't happen in specific non-white groups. Other cultural and beliefs and traditions that participants reported, the topic of filial piety came up a lot in East Asian groups. And this is the traditionally held value that children are supposed to not only take care of the parents in their older age, but the parents are owed complete respect, unquestioning respect. The children have to continue the bloodline and always bring honor to the family. Participants in the East Asian groups reported that the parents made them feel guilty for dishonoring the family by being LGBTQ, for abandoning their duty to continue the bloodline. And in general, sometimes the parents felt that even the coming out itself was not necessarily respectful to the parents. Um, Many of the participants in the East Asian group felt that there was an internal conflict between the person that they wanted to be and the fact that that person could not exactly obey the filial piety dictate that was expected of them. In the collectivist cultures, which is rural Canada, South Asia, and East Asia groups, parents were reportedly very concerned about other people's opinions in response to their youth's coming out. So there was not only the conflict within the family where the parents might not have been supportive, there was also the conflict of what are other people going to think? How can you do this to us and shame us in front of the community? And in the East Asia group, the other notable barrier that was reported was the language barrier, where a lot of the parents continued to speak the language of their home country. The kids actually had to be translators oftentimes when the parents went out in the larger community. But those youth were raised here in Canada. They knew English as their first language, really, and spoke very little of their parents' home country or mother tongue. In addition to not having the words because their grasp of the language was very beginner level, some participants reported that the only words they knew for LGBTQ in Chinese, for example, were actually derogatory terms. And so you can't really start a discussion about the topic when the only words you know are derogatory. It's almost a non-starter to the conversation and definitely does not feel supportive to begin with. So this study points to the importance of cultural responsiveness in resources for families going through the coming out process. And this is important for healthcare professionals to remember because educating or counseling parents on the topic of their youth sexuality or gender diversity cannot succeed without understanding the parents' underlying beliefs and value systems, which may be quite different than the Western culture and values that are dominant in Canada. Oops, oh, sorry. It's also important to understand the difficulties that are faced by youth who come from diverse backgrounds. Canadian LGBTQ youth of South and East Asian descent must navigate between the Western culture they grew up in and their parents' values and beliefs, which, like I said before, can be in conflict with that Western culture. So participants also from participants facing rejection at home are also at an increased risk if they face stigma as racialized people in Canadian surroundings. So they are kind of rejected at home, and then they might be facing stigma and rejection in their outside society at large because they're racialized, which complicates their and increases their risk of health and well-being adverse events. And therefore, it's important to look at the accessibility of resources for that 2S LGBTQ plus youth may need outside the home, especially mental health resources, and especially if they come from a background where mental health care is also stigmatized. They may not be able to ask their parents for access to mental health. How are we going to ensure that they're able to get that help if they cannot rely on the parents? And these are all considerations that, again, involve cultural beliefs, involve the family's value system that we need to take into account when looking at resources and designing systems for youth LGBTQ to utilize as they need. And that is a summary, a very short summary of this study. And I, I'll take questions now.
Thank you, Adi. I mean, I think it was extremely insightful and also goes to say how important parents really are in the process. And I think as a South Asian, I felt like a lot of it was very relatable as you were talking about all of the experiences that they were sharing and the conclusions that came out of it. I'm wondering if anybody has any questions, they can drop it in the chat or feel free to unmute yourselves and just ask it out loud.
So I'm not sure I have a question as much as a comment, but maybe it'll lead to a question. Thank you, Addie, for presenting this work. It has been fascinating for us to recognize the um, some of the cultural perspectives and differences that may add some unique issues for young people coming out. But also, and I think the piece that I'm keen to hear about is that when we're talking about these, we're sort of thinking about them as collectivist societies or cultures where the family, the community is where individuals actually reflect on the community as a whole. So your or the family as a whole. So what you do as an individual may have an impact on how your family is viewed, not just how you yourself are viewed, and that is as opposed to a more individualistic kind of approach. And so I'm also mindful that our rural, so part of our study was actually thinking about even here in Canada, the rural communities are more collectivist. Everybody knows everybody. It's smaller. There are this sense of how you fit in and how you engage is also in many ways a more collectivist as opposed to an individualistic approach. Do you have any thoughts on how the rural that aren't necessarily explicitly South Asian or East Asian young people, how those might be similar or different to what we saw with the East Asian and South Asian communities generally?
I think it is a matter of a community that's very self-reliant, usually because of original circumstances, being more isolated. But the community itself, everybody knows each other's business because they sort of rely on each other, and that is very similar in many cultures that are collectivist. And I think that, yeah, the similarity is also there is usually kind of a leader or leaders that are either faith leaders or a leader of an organization that is important in this community. And I think working through those leaders of collectivist communities, regardless of the culture, is probably the best way to disseminate knowledge. So there is the similarity between all of them of a community that is very close knit, um, needing each other and sort of centered around one or a few leaders that have an influence. And I think that in those communities that would be probably the most effective intervention, if you'd like to call it clinically, is to educate the leaders and have them disseminate the knowledge. I think it would also come through better than trying to come from above as a researcher, the helicopter researcher that disseminates knowledge and then goes away. If you're not from this community, especially in collectivist community, if you're not part of a collectivist community, you're not going to be very accepted or believed very easily. I'm not sure if I'm answering your question.
I think that's a
Like,
very good point. I also see a question from Tessie here. She said it was suggested in the study for parents to be more informed. Are there any programs or tools that are currently being used to fill that gap?
so I know that we are looking at working with at least one organization, or at least we have an application for a study that's looking at support groups for uh, parents of teen trans gender diverse teens. Sorry. Yeah. So we are looking at that kind of an intervention. Um, I'm sure there are others similar interventions that exist in other places. I don't know of any centralized, unfortunately, educational resource that anybody can go to, but there is a website that was launched. Again, it is for transgender and gender diverse youth and allies and parents, called weareallies.ca. Now that is an educational source, as well as a source of advocacy and countering misinformation. So it's kind of an all around, but it's only aimed at the gender diverse populations. So as far as I'm sorry, Elizabeth, you had something to add?
Yeah, just wanting to chip in as well that there are organizations. So Share Vancouver is an organization that we partnered with on this research, and they are a South Asian to us LGBTQ plus community group, and they do provide some um, supports for parents and some training. And then we do have. On our website. It's a bit like a number of years ago that we created them. Some brief little 3-minute animated videos for East Asian parents in Chinese, Korean, and Japanese language to talk about ways to support your LGBTQ, especially sexual orientation, sexual minority youth, as a parent. So there are, yeah, spits and spots of resources. I don't know at this point that there are any specific programs that are um, targeting particular populations. We are in the process. We have funding from Health Canada to develop some materials and some training sessions for parents around sexual health that will also include,
Mhm.
sexual orientation, as part of that, or sexuality as part of those sessions, and they are targeted towards, migrant populations. So we'll certainly be, with, South Asian community, and we are looking at that potential for within the different East Asian communities, Chinese, and South Korean. So there are, I mean, we're putting some of those resources out there, and I'm sure there are other groups. It's just that, there hasn't been a major campaign in the same way as the We Are Allies campaign. There hasn't been a similar one focused for, South Asian families or for East Asian, families and parents. It's definitely one of those things that we see as a need out there.
Mhm. Thank you.
Thank you so much, Elizabeth. In the chat, I've put the link to the videos you were talking about for East Asian parents. And then I've also dropped our sign up form for the newsletter where we share our upcoming webinars, events, and quarterly updates. So please feel free to share along. And unless there's anything else anyone wants to ask, thank you, Addie, again for this wonderful presentation.
Thank you. Thank you. Thanks
Yeah.
again.
It was great.
Thank you.
Very good.
Thank you so much.
Thank you.